So hello students, let us understand this parotid gland. Parotid gland. Okay, some MCQs which are asked on this topic: the nerve supply of parotid gland, the contents of parotid gland. Now, parotid is the largest salivary gland. As we all know, it's the largest salivary gland. And if you see this parotid gland, if you try to understand this parotid gland, where is this parotid gland located? There's an area here into which the parotid gland fits, and this is what we call as the parotid mold. Parotid mold. I'll draw a slide for you students. This slide we have been drawing right from the beginning of the lectures. Yes, beautiful. Yes, that's the eye. That's the body of the mandible. That's the body of the mandible. That's the ramus of the mandible. That's the ear here. That's the mastoid process. That's the sternocleidomastoid. Sternocleidomastoid. And along with the sternocleidomastoid, that's the posterior belly of digastric. Along with the sternocleidomastoid, there's a muscle, posterior belly of digastric. Fine. So now, where is our parotid gland? Our parotid gland is exactly here. So that's the ear. So our parotid gland is located exactly like this, here and here. So that's how the parotid gland is. So this would be the base of the gland. So the base is related to the external acoustic meatus, right? So this gland has got three surfaces. It's something like this. You take one triangle like this with the base above, apex below. You take another triangle and you take one more triangle and you join them. You join these three triangles. So you get a structure something like this. Okay. You get a structure something like this. And this is nothing but the parotid gland. That's exactly how the parotid gland is. So I made something for you students. Look at this. I made something for you. So this is one triangle. Can you appreciate this? This is one triangle. This is one triangle. This is a cotton that I made a small model for you. This is one triangle. That's a second triangle. If you see from here, that's another triangle, the base above, the apex below. And that's a third triangle, the base above, apex below. So you just take three triangles and you join them together like this. And this is what we get is the parotid gland. So this parotid gland will have three surfaces. This surface, and just place it here like this. You just place it here. So this surface is the superficial surface. Superficial surface. The surface in front here would be the anteromedial surface. Anteromedial surface here, and the surface behind is going to be the posteromedial surface. Posteromedial. If I have to draw the parotid gland here for you like this, so this surface that we're looking from outside here like this. So this is going to be the superficial surface, right? Now, if I draw a surface here, this one, this surface is the anteromedial surface. And this anteromedial surface would be related to what? It is related to the ramus of the mandible. Ramus of the mandible. There's a muscle inserted on the ramus here, outside. What is that muscle? Masseter. And there's a muscle inserted on the ramus and the angle inside. Any guesses? Any guesses? You know this. So there are two muscles on the angle, one outside, that's masseter. Very good, very good. Yes, the second one is what? Medial pterygoid. Medial pterygoid. So this anteromedial surface of the parotid gland would be related to the ramus of the mandible, the masseter, and the medial pterygoid. Perfect. Very good, students. Excellent. Now coming to this third surface. This third surface, if I draw it like this here for you, so this is the posteromedial surface, posteromedial. So this one is the superficial surface here, superficial. This is the anteromedial surface, anteromedial, and this is going to be the posteromedial surface. Now this posteromedial surface would be related to this muscle. What is this? Sternocleidomastoid, the posterior belly of digastric. Sternocleidomastoid and the posterior belly of digastric with the styloid process also, which is related to the posteromedial surface. Clear? Now, this superficial surface would be covered by the skin, superficial fascia, deep fascia, and the platysma muscle. Platysma. So that's about the superficial surface. The base is related to the external acoustic meatus. The apex goes down in the digastric triangle. It goes down in the digastric. So students, are you clear with this three surfaces of the parotid gland? The superficial surface from outside, the anteromedial, the posteromedial surface. So it will have three borders, right? What do you call this border as? Just one moment. So what is this border? This border is going to be the anterior border. What is this border going to be? The posterior border. And this border is going to be the medial border. Medial border. Anterior border is this in front, posterior border is this behind, and the medial border is deep inside. It is related to the pharynx. It would be related to the pharynx. Clear? So this becomes the relations of the parotid gland. This parotid gland is enclosed by two capsules. One is the true capsule and the second one is the false capsule. True capsule and the false capsule. False capsule for any gland is formed by the fascia which covers the gland. The fascia which covers the gland forms the false capsule, and the true capsule for any gland is formed by the condensation of the connective tissue around the gland. So this parotid gland will be lined by two capsules. So if I write it like this, capsule, one is true and the other one is false. True and false. So true capsule is formed by the condensation of connective tissue. Condensation of connective tissue around the gland. Around the gland, right? That forms a true capsule. And the false capsule is formed by the fascia which covers the gland. The fascia, which is going to enclose the parotid gland, that's the investing layer. Investing layer of deep cervical fascia. Investing layer of deep cervical fascia. Investing layer of the deep cervical fascia. Now this investing layer, it comes here, it comes at the base of the gland, it divides into two parts. It splits to enclose the parotid gland, right? The investing layer of the deep cervical fascia, it will come here, it splits into two. One layer goes above the parotid gland and it is attached to this zygomatic arch. Okay, so the investing layer comes here, divides into two layers. One layer goes over the parotid gland, attaches to the zygomatic arch. The second layer goes deep to the parotid gland and it is attached to a long process at the base of the skull. What is that process? The styloid process. Styloid process. And this part of the fascia between the styloid process and the mandible is what we call as the stylomandibular ligament. Stylomandibular ligament. So the investing layer splits here, encloses the parotid. One layer goes above the parotid, superficial to the parotid, gets attached to the zygomatic arch. The deep layer goes and gets attached to the styloid process. So that's how the investing layer is going to enclose the parotid gland, forms the false capsule for the parotid gland. False capsule. True capsule is formed by the condensation of the connective tissue around the gland. Fine, students. Now, what are the contents of the parotid gland? Contents. Okay, this is another very important MCQ. Contents of the parotid gland from superficial to deep. From superficial to deep, the first one is facial nerve. Facial nerve. The facial nerve enters into the parotid gland. The facial nerve emerges out through the stylomastoid foramen, enters the parotid gland, then gives 5 branches here to supply the muscles of facial expressions. The temporal, the zygomatic, the buccal, the marginal mandibular, and the cervical branch of facial nerve. We know this. So the first superficial content of the parotid gland is facial nerve. The second one is the retromandibular vein. Retromandibular vein. We know this retromandibular vein is formed by the joining of two veins, the superficial temporal and maxillary joins to form the retromandibular vein and its two divisions, retromandibular vein and its divisions, anterior and posterior divisions. We know this. They lie within the parotid gland, and the deepest content of the parotid gland is the external carotid artery with its branches. With its terminal branches. So the external carotid artery is the deepest content of the parotid gland. The external carotid artery divides into two terminal branches within the gland, the superficial temporal and the maxillary, right? So students, what are the contents of parotid gland from superficial to deep? The facial nerve, the retromandibular vein, and the external carotid artery. Be very clear about this. Be very clear. Okay, fine. So that's about the parotid gland. Right. What is the nerve supply? So what is the artery supplying the parotid gland? The external carotid artery and its branches, the veins, the retromandibular vein, What is the nerve supply of the parotid gland? Students, we had done this in the ganglions of head and neck. You remember the ganglions of head and neck, which is the cranial nerve supplying the parotid gland? Yes, the glossopharyngeal nerve. Very good. So the cranial nerve supplying the parotid gland is the glossopharyngeal nerve. So when we say nerve supply, your answer is going to be the glossopharyngeal nerve. Right. What is the name of the nucleus of the glossopharyngeal nerve which is going to supply the parotid gland? Students, answer now. You know this. What is the name of the nucleus of the glossopharyngeal nerve in the brain to supply the parotid gland? The name of the nucleus is inferior salivatory nucleus. Inferior salivatory nucleus. That's in the brain. We get the tympanic branch. Tympanic branch of glossopharyngeal nerve. So inferior salivatory nucleus is the nucleus of glossopharyngeal nerve. Its tympanic branch. What is the tympanic branch of glossopharyngeal nerve known as? Jacobson's nerve. So tympanic branch of glossopharyngeal nerve is known as Jacobson's nerve. It joins with the sympathetic plexus and forms what? It forms a tympanic plexus. Tympanic plexus. This tympanic plexus lies on the medial wall of middle ear. That is what we call as promontory. The tympanic plexus lies on the medial wall of middle ear. That's the promontory. From this tympanic plexus, we get a nerve. That's the lesser petrosal nerve. Lesser petrosal nerve. Now, this lesser petrosal nerve, used to know, students, it gets out through foramen ovale. So, lesser petrosal nerve gets out through the foramen ovale, relays in a ganglion. Look, that's our ganglion. That's a parasympathetic ganglion, otic ganglion. And the postganglionic fibers will be going and supplying the parotid gland. Okay, that's the nerve supply of parotid gland. So the postganglionic fibers will supply the parotid gland, and so this is in the brain, right? That's in the brain. So from the brain to this ganglion, what are these fibers? The preganglionic fibers. And what are these fibers? The postganglionic fibers. Students, if you can answer this, who's going to carry the postganglionic parasympathetic? This is a parasympathetic nervous system. Who's going to carry the postganglionic parasympathetic fibers from the otic ganglion to the parotid gland? It is carried by the auriculo, yes, very good, auriculotemporal nerve. You remember auriculotemporal nerve? This auriculotemporal nerve is a branch of the posterior division of mandibular nerve, and this auriculotemporal nerve is going to carry the postganglionic parasympathetic fibers from the otic ganglion to the parotid gland. Clear? So that's the nerve supply of parotid. We have seen this before, you know this. Now, this parotid gland, inflammation of parotid gland is known as mumps. Now, this parotid gland has a duct, right? This parotid gland has a duct. It's a salivary gland, correct, no? So this gland has a duct, and this duct would begin from the anterior border of the gland. This duct is known as the Stenson's duct or the parotid duct or the Stenson's duct. It runs over the masseter muscle like this. It goes over the masseter, now turns at right angles. It pierces the buccal pad of fat. It pierces the buccopharyngeal fascia, and now it opens in the vestibule of the mouth opposite to the crown of upper second molar tooth. Okay, that's a very important thing that you have to know. The Stenson's duct. That's the parotid duct. Okay. Runs on the masseter. I'll just write the important things. Runs on the masseter, then turns at right angles. Runs on the masseter, turns at right angles, pierces the buccal pad of fat. It pierces the buccal pad of fat. Pierces the buccopharyngeal fascia. Pierces the buccinator muscle. So three things it pierces: the buccal pad of fat, the buccopharyngeal fascia, and the buccinator. And where is it going to open? It opens in the vestibule of the mouth. What is vestibule? Vestibule, you know, it's the part where we put the brush to brush the teeth. That's a vestibule. So it opens in the vestibule of the mouth opposite to upper second molar tooth. Upper second molar tooth. Okay, so it opens in the vestibule of the mouth opposite to the upper second molar tooth. That duct is known as parotid duct or the Stenson's duct. Students, clear? So that's about the parotid gland. It's a very simple topic. What is important are the surfaces, the capsules, the content of the parotid gland, the nerve supply of parotid gland, and something about the parotid duct. Runs on the masseter, turns at right angles, pierces the buccal pad of fat, buccinator, buccopharyngeal fascia, and opens in the vestibule of the mouth opposite to the crown of upper second molar tooth. Inflammation of parotid gland is known as mumps. Okay, I hope this topic is clear to all of you, students. Yes, is this topic clear to all of you? I hope this topic is clear to all of you. Thank you for your patient listening. Thank you.